The thresholds themselves are really quite nonsensical in some sense. It's 50-year-old data, updated by inflation, and it just doesn't reflect any of the consumption patterns that we have today. Food prices have fallen. The share of food in the budget is down to about 1/7 to 1/8. We now actually have some data on which you could think about differences in prices across different regions as opposed to a single national number. So this is just, it's a threshold that doesn't make a lot of sense other than the fact we've just used it forever, okay? The resource measure is somewhat outdated as well. Since 1963, we've expanded a whole bunch of in-kind programs that don't give people cash and aren't counted, such as food stamps and housing assistance and LIHEAP, the low-income low-income health assistance. And that doesn't matter. We made a lot of changes to the tax system so that most people actually get tax refunds back through the earned income tax credit. That's not counted. And there's a lot of changes in terms of how people deal with health, as well as work, as more and more women go to work. And in a minute, I'll talk about an alternative that takes some of those into account. Well, why do we care about this? So it's a bad statistic, so what? The answer is that we care because this statistic doesn't take account of any of our policies. And we've enacted all of these policies that are really designed to help low-income families, and there is no way in which our poverty measure can possibly reflect them, because they don't count the things that these policies do. And in that sense, in a very fundamental way, our poverty statistics have failed. It's made it very easy to claim that none of these programs have had any effect, because look, the poverty measure on average hasn't gone down over a long-term period. And that's just wrong. And the problem is that the programs didn't have any effect. The problem is that the statistic was simply basically flawed. And it's a wonderful lesson in why you actually want a statistic that measures not only what happens in the economy, but also what's happening out there in terms of programs. So in the mid-1990s, Congress asked the National Academy of Sciences to impanel a group to come back with a set of recommendations on how to improve this. I was part of that panel, and they came in with a set of recommendations. And again, the paper over there can give you more detail on this, in which they said, look, let's define a threshold based on a broad set of necessities: food, shelter, clothing, utilities, plus a little more. This should not only vary with family size, but it should also vary a little bit by, and what the main thing is in which people do here is housing prices, because it's housing prices that vary. And New York City shouldn't have the same poverty line as rural Mississippi, right? The resource measure should be not just cash income, it should be cash income after taxes, counting the in-kind transfers, which can be used to pay for food, shelter, utilities, and clothing, right? The things that are in your threshold. And then minus some expenses that we think are necessary, said the panel, but which take away from what you can spend on necessities. So work expenses. We think everyone should work in this country, but work does involve some expense, and we don't want to subtract that expense off before we say, what do you have available to pay for necessities? That includes transportation expenses, and of course your fuel costs come into that a little bit, and it includes childcare. And then, in addition, we don't want to impute the value of Medicaid and health insurance. That's a very hard thing to do, and you don't want to add lots of dollars to poor people because they have insurance. I mean, that is often not the right way to say now they're no longer poor. But instead what we do is take account of out-of-pocket medical expenses. So if you have good insurance, you don't pay as much out of pocket. If you have bad insurance, you pay more. And this really matters for the elderly, because there are some elderly out there paying huge amounts in out-of-pocket expenses, and you want to subtract that off before you say, what do you have left to buy your necessities? And you ought to update this regularly. So, this is a quick review over, what are some ways to change this? There's, I think, quite a bit of consensus among many people that this National Academy approach is a good way to go. The interest in this is rising, and here's particularly why you have to know this. Not only are some states and cities coming back and saying, we need a better measure, which is putting some pressure on the feds to do something, and many of you may know that New York City 2 months ago took the National Academy approach, actually over the last year, calculated a whole new measure for New York City based on this approach and has released it, and Mayor Bloomberg's been talking about this now for some time. But there's also draft legislation, and Congressman Jim McDermott, and India sitting over here is working very closely with this, is planning to introduce draft legislation very soon into the House. And Senator Dodd, with the assistance of Senator Kennedy as well, is talking about introducing such a bill in the Senate in this Congress, though it probably won't move this Congress. I think everyone agrees to that. So that this is an issue that is rising in the conversation. And I will simply close by saying that if we care about poverty and economic need, we need to have a modern statistic based on current patterns of behavior and income and well-being that tells us how we're doing and how changes in our economy and changes in our policy are affecting low-income people.